It is very important for the healthcare providers to understand the key differences between cervicogenic dizziness versus vertigo. I'll be giving you 5 key findings to know the difference. In cervicogenic dizziness, the patient age group would be usually from 20 to 60. Vertigo will never happen for people as young as 20 years. Since vertigo is more or less like an age-related process, it can start from 40 and it can do 60 or even 70 years. The Dix-Halpix maneuver is usually done to confirm the presence of nystagmus for vertigo patients, whereas in cervicogenic dizziness, it will be negative. Thirdly, in vertigo, the attack will be usually abrupt in onset. All of a sudden, they suddenly feel that the world is spinning around them or they are spinning around the world, and it lasts for many minutes. But in cervicogenic dizziness, the onset would be gradual. The patient usually knows that they have been having it for a while. In cervicogenic dizziness, the flexion extension movement will produce the disease spell, especially in the kitchen. They do something and then they look up and then they feel slight dizziness for about 1 to 2 seconds. Then it will vanish by itself. Most people can tolerate dizziness. Whereas in vertigo, the provocatory movement would be turning the neck, especially in the morning they turn and get up. That time they can easily get it. The duration of the attack in cervicogenic dizziness is lasting usually for 2 to 3 seconds and then they'll be absolutely alright. They can recover well and then they can carry on with their normal activities. Whereas in vertigo, the duration will be lasting longer. They cannot carry on with their regular activities. They had to take bed rest. They had to take some medications to reduce the symptoms of vertigo. Whereas in dizziness, they don't need any medications because they recover in a quick period of time. Cervicogenic dizziness will oftentimes accompany with cervical spondylitic like symptoms, like they also will have neck pain, they also would have headache. If any of these symptoms are there in your patient who are also having dizziness, then you can presume that the dizziness is due to the result of cervical pathology. Whereas in vertigo, usually they will not come with neck pain, difficulty in moving the neck. They will be having only vertigo. They usually will not have other symptoms of cervical pathology. Whereas in vertigo, you have to treat the inner ear where the crystals are dislodged and that causes the erratic information going up to the brain. That causes people to feel that vertigo attack. And most times the vertigo attack can accompany with vomiting and lightheadedness. In that way, you can discern the patients who are having vertigo versus cervicogenic dizziness. Many patients of mine who I treat, they think the dizziness is like vertigo and they're taking medicines for vertigo wherein they actually have cervicogenic dizziness. Apart from cervicogenic dizziness, there are so many other reasons for dizziness. Those things are not uncommon, but the majority of the people in the world, especially the current generation who are having dizziness, more likely that their dizziness is due to the cervical pathology. In cervicogenic dizziness, the neuropathophysiological underpinning is when the meninges gets irritated in the cervical spine, or when the upper cervical nerves are compressed due to disc problem, or when there is a reduction in the CSF flow due to the canal stenosis. These are the reasons why one can have cervicogenic dizziness. I hope you understood and learnt something today. Thank you.